hours every night in one of four positions: left side, right side, back, or stomach. You chose the position decades ago, probably as a child, and you have defaulted to it every night since without questioning whether it matters. It matters. Your heart, your stomach, your liver, your lungs, your airway, your brain's waste clearance system, and the arteries in your neck are all asymmetrically arranged inside your body. None of them are centered. Gravity acts on all of them for 8 hours, and the direction gravity pulls them depends entirely on which surface you are lying on. Each position produces a different gravitational relationship between your organs and the structures surrounding them. One position wins on more systems than any other. One position damages a structure nobody mentions. And one position, the one most people assume is the safest, is the worst for more than half of all diagnosed sleep apnea. 4 positions, one body, 4 different physics, and the position you default to tonight determines which organs receive protection and which receive additional stress for the next 8 hours. Left side first, because this position wins on 3 independent systems through 3 different mechanisms, and the first one involves the largest vein in your body, inferior vena cava. The vein returning blood from the entire lower body to the heart runs along the right side of the spine. Left side sleeping avoids compressing it under the weight of the abdominal organs. Right side or supine sleeping can partially compress the IVC, reducing venous return and cardiac preload. During pregnancy, fetal weight on the IVC in the supine position can reduce maternal cardiac output by up to 25%, which is why left side sleeping is specifically recommended for pregnant women. The recommendation applies beyond pregnancy. Left side sleeping provides optimal IVC patency and therefore optimal venous return in every adult. Heart itself sits slightly left of center in the chest, resting in the cardiac notch of the left lung. On the left side, gravity assists its natural anatomical position. On the right side, the heart shifts across the mediastinum, a displacement that is insignificant in healthy individuals but detectable in patients with cardiomegaly or heart failure, who sometimes report palpitation awareness and discomfort when the enlarged heart shifts against gravity. Thoracic duct, the body's largest lymphatic vessel, collecting lymph from 3/4 of the body, empties into the left subclavian vein at its junction with the left internal jugular. Left side sleeping aligns this drainage point with gravitational assistance. The lymphatic return flows downhill into the venous system. Right side sleeping routes the final lymphatic delivery against a less favorable hydrostatic gradient. 2 fluid systems, venous and lymphatic, both benefiting from the same gravitational direction. If you wake in the night feeling short of breath while lying on your back, the breathlessness may be partial IVC compression reducing venous return and cardiac output. Rolling to the left side removes the compression. The issue was vascular geometry, not the lungs. Stomach next, the acid reflux physics is geometry that a position change solves faster than medication. Your stomach curves from left to right, with the greater curvature on the left and the esophageal gastric junction positioned on the right side of the stomach's superior surface. On the left side, gastric contents, food, acid, digestive enzymes pool in the greater curvature, which becomes the lowest point. The esophageal junction sits above the pool. Gravity keeps acid away from the junction. The lower oesophageal sphincter is dry. On the right side, the geometry inverts. The greater curvature is now the highest point. Gastric contents pool toward the esophageal junction, which sits at or below the gastric pool. Acid bathes the sphincter. If the sphincter is even slightly incompetent, common in adults over 50 with any degree of gastroesophageal reflux, acid crosses into the esophagus. Reflux episodes were significantly more frequent and more prolonged in the right lateral position compared to the left, as Cowrie and colleagues documented in the American Journal of Gastroenterology. Same person, same stomach, same acid, different geometry. The position determined whether the acid reached the esophagus. If you experience nighttime acid reflux, the burning that wakes you at 2 in the morning, the sour taste, the morning hoarseness, and you sleep on the right side or on the back, the problem is geometry before it is a sphincter problem. Left side sleeping places the acid below the junction. The burning may resolve without medication because the acid never reaches the sphincter when gravity pulls it the other direction. Brain waste clearance comes next. This mechanism was unknown until 2012, and the stakes are neurodegeneration. The glymphatic waste clearance. The sleep timing discussion describes cerebrospinal fluid flushing amyloid beta through perivascular channels that open during sleep operates with different efficiency depending on position. The balance between amyloid beta production during waking hours and clearance during sleep determines whether the protein accumulates over decades, and clearance rate depends, in part, on which direction the body is lying. Lymphatic transport is most efficient in the lateral sleeping position. As Lee and colleagues documented in the Journal of Neuroscience in 2015, both lateral positions significantly outperform supine and prone in a rodent model. The brain clears its waste most effectively when you sleep on your side. Back sleeping and stomach sleeping produce slower clearance of the proteins that accumulate in neurodegenerative disease. Mechanism is fluid dynamics. In the lateral position, gravity assists drainage of cerebrospinal fluid through the internal jugular veins. The veins that drain blood and CSF from the brain are oriented favorably when the body is horizontal and lateral. In the supine position, the jugular veins are partially compressed by the weight of the neck structures above them, and the drainage pathway is less efficient. If you have a family history of Alzheimer's and have been told to do crossword puzzles and eat blueberries, nobody has mentioned that your sleeping position affects how efficiently your brain clears the protein that causes the disease. 8 hours per night, 365 nights per year, decades of waste clearance that runs at higher capacity on the side than on the back. The position determines whether the brain's cleaning system operates at full flow or at partial flow every night for the rest of your life. Intracranial pressure adds a second brain-relevant dimension to the position calculation. Supine sleeping elevates intracranial pressure compared to lateral. The hydrostatic physics is straightforward. Lying flat with the head at heart level produces higher venous pressure in the cranial vault than lying with the head slightly elevated by a pillow in the lateral position. The elevated pressure is clinically relevant through two pathways. Intraocular pressure, the fluid pressure inside the eye, rises during supine sleep, and the elevation is a documented risk factor for normal tension glaucoma progression, the form of glaucoma where optic nerve damage occurs despite apparently normal daytime pressure readings. The damage occurs at night during the hours of elevated IOP that supine sleeping produces and lateral sleeping reduces. For anyone with a glaucoma diagnosis or family history, sleeping position is a modifiable risk factor that ophthalmology appointments rarely mention. Second pathway is idiopathic intracranial hypertension, elevated brain pressure, without an identifiable structural cause, which produces chronic headache, visual disturbance, and papilloedema. Lateral sleeping reduces the baseline